ultrasound guidance for vascular access. We're going to be using a linear ultrasound probe to guide the positioning and placement of this needle to gain access to a vein, artery, or any other vascular structure that you need to get access to in a quick and fast, efficient means without jabbing your patient multiple times. Put your transducer on the patient's skin, center the image, the vessel, in the center of the transducer face. We have multiple crystals across here. We're going to center the vessel directly under the transducer center so that when I enter the skin, I'm going to hold the transducer at an angle, I'm going to hold the needle at an angle, and hopefully they will meet at a point near the vessel in the center of the image. I'm going to keep advancing it until I see the needle show up in the image. I want to come in at a fairly low angle so that I can see the needle show up in the image above the top of the vessel. I don't want it to already be through the vessel. I don't want it to be below the vessel. I want to see it on top of the vessel, because then I can position my needle right or left to put it directly over the top of the vessel itself. Once I'm directly over the top of the vessel, all I have to do is angle up and enter the vessel. By moving the transducer with the tip of the needle, I can follow it as it goes until I actually see it penetrate the vessel wall and end up being center lumen on this vessel. And what I'm doing is entering the skin. I'm looking for my needle to show up in the image above the top of the, there it shows up. You can see it right there as I advance and back it up. That's the tip of the needle. And you can see I'm not exactly over the top of the vessel. So by angling the needle sideways, I can now advance the transducer, advance the needle. I can angle it over a little bit more and advance the transducer. Advance the needle, advance the transducer. Advance the needle and then the transducer until I'm right on top of it. Now that I'm right on top of it, I'm actually pressing on the vessel itself. All I have to do is bring the hub of the needle up a little bit, and I'm in. We're now in the vessel. At that point in time, I can now put the transducer down, can disconnect the syringe. You can do this without a syringe. You can look for your blood flash right here. I can thread my wire if I'm going to do a PICC line. If I'm going to be doing a venous ablation, I can get my guide wire in. Once the guide wire's in, pull the needle out, hold your guide wire, put in your introducer sheath right along the same pathway, and you've got instant access. So for vascular access, again, transducer, 90 degrees, vessels in a short axis, bevel up, enter at a very steep angle till you see the needle over the top of the vessel. Then all you got to do is turn your, once you get over the top of the vessel, angle up and follow that needle with the tip of the transducer. It's two-handed. You're advancing both needle and transducer at the same time, following the tip of that needle until it enters the vessel. Once it enters the vessel, you get your flash, you get your, put in your guide wire, and access is there.
What are the benefits of utilizing this technique?
You reduce the number of sticks that you subject your patient to, for the first thing. It enables you to quickly and easily access vessels in dehydrated patients, patients with small vessels, patients with deep hidden vessels that you can't see from the surface even with a tourniquet in place. Ultrasound will quickly identify them. It prevents you from sticking arteries by mistake, or unless you're going for an artery, then it helps you position it in the artery. So it really is an adjunct to either arterial or venous access. Okay, here's another technique that a lot of people find very useful. If you're having trouble following the tip of the needle while you're advancing it, you can enter, you can get over the top of the vessel, and then you can rotate your transducer to see the needle in a long axis, and then tip up and puncture the vessel. Now I can watch the needle go right into the vessel and know that I have not gone all the way through. So by lining up the needle in the same plane that the vessel's in, now you can see exactly where the tip of your needle is and know that you are center lumen on the vessel. This way you get to see the depth and the advancing of the needle without having to move the transducer at the same time you're advancing the needle. Some people find this easier. Some people have a more difficult time getting it to line up because now you have to have the transducer in perfect alignment with that needle to be able to see it. If you've got it at an oblique, unless you are perfectly lined up with it, you're not going to see it this way. But if you can, and you can visualize it, it makes it very easy. That way you don't go through and through the vessel. You don't perforate the posterior wall, and that's especially important in your arterial sticks.